we again returned 0 positive results. That is, all of those tests returned negative, meaning we still have just those 4 active cases. That compares to, in other states, now 18 active cases in New South Wales as of yesterday, and in Victoria, 1,612 active cases. And of course, we will monitor throughout the day the number of cases reported in those 2 states. I can also confirm that 18 Queenslanders who had visited the Crossroads Hotel have now been tested. The results of those tests are not yet back, but we thank them for their assistance and for agreeing to be tested. The Chief Health Officer in a moment will outline her intention today to issue directions which will create hotspots, identify hotspots in New South Wales, in Campbelltown City and Liverpool City as a result of that Crossroads Hotel outbreak, and she will outline for you what that means. I can also announce today that this week in Parliament we will further strengthen our public health laws, further strengthen the powers available to the state to keep Queenslanders safe. Right now, the maximum penalty on the spot for breaching our public health orders is $4,003, but in some cases that fine appears to not be a sufficient penalty. Perhaps people from other states think they might get away without having to pay for it. Perhaps people think that $4,000 is worth it to come to Queensland, worth the risk. So this week we will move amendments that will allow us to apply a penalty of imprisonment for breaches of those health directions. So the maximum penalty on the spot will be $4,003 or up to 6 months imprisonment. And I hope that that will demonstrate to the public just how serious we are about enforcing these measures, just how serious it is that everyone complies with them, and just how serious the penalty might be if they fail to do so.
So today in Queensland there are 18 people who visited the Crossroads Hotel in New South Wales and came forward and have been tested. They're all now in home quarantine. As of midday today, I've now declared that Campbelltown City and Liverpool City are both hotspots, which means anyone who has been in those areas in the previous 14 days and comes into Queensland will need to go into mandatory hotel quarantine. This is important because we are seeing continued numbers of cases being confirmed who attended that hotel, and we've seen subsequent infections in families and other groups from people who have come into contact with people who went to that hotel. Thank you.
Chief Health Officer, so does that mean that if Queenslanders travel to those areas, when they come back, they will have to go into hotel quarantine, or can Queenslanders go into home quarantine?
As of midday today, Queenslanders who travel to either of those hotspots or any of the hotspots in Victoria, and today all of Victoria is deemed a hotspot, will need to, when they come back into Queensland, go into 14 days quarantine in a hotel.
Are you looking at New South Wales broadly now, like as a state? Are you is that going to be something you're looking at in coming days, like you've said about Victoria, if it gets?
Yes, I'm looking at the whole country every single day. So I meet with my colleagues from around Australia every day, and we talk about outbreaks that are happening in their states.
The 18 people that are here now who've been to the Crossroads Hotel, are they Queenslanders or are they people who were coming here to holiday from other states?
I don't have that specific information, but all of them I'm very, very grateful to. They came forward and they said they had been to the hotel and they got tested.
Is that the total number of people you know who are currently in Queensland who have been to the hotel, and do you anticipate that number to grow at all?
I do anticipate it to grow, yes.
Dr. Young,
that's the total I know of at this point in time.
The threshold you have to reach to declare a hotspot, what are you looking at?
It's when there's clearly growing numbers of cases and there's community acquisition of cases. So we've seen that here. We've seen initial cases of people who went to that hotel on the 3rd of July, and then we've seen subsequent infections from those cases.
Dr. Young, can you explain why Danny Minogue and her son were given an exemption?
No, they weren't given an exemption. They are required to quarantine in a different place. So the default arrangement in Queensland is if you don't have a COVID-safe plan or an industry plan or an exemption to hotel quarantine, then you go into hotel quarantine. There are a large number of different groups that have exemptions to hotel quarantine. For instance, consular officials, ADF personnel, people who work in the oil and gas industry who meet certain requirements, maritime workers, flight crew, people who work in specific film and entertainment industry, elite sporting groups. So there are a number of groups, and I believe I've given 38 such exemptions to date for mandatory hotel quarantine, but they need to then quarantine in another place that I'm satisfied adheres to the same requirements.
Given some of the heartbreaking stories we've had and you've had to wrestle with, people who have dying family members, can you assure people that there's no special treatment for a celebrity?
No, there's no special treatment for anyone. I do ensure that anyone who is struggling with hotel quarantine gets support, and we have support arrangements in place for that situation.
So just to be clear on that, is that because she's a judge on a show that she's been granted this other style of quarantine?
No, she has a COVID-safe plan that is being managed by an independent third party. That's the reason that she got that exemption.
And that's obviously not incurring any charges because it's her own accommodation, is that right?
It's not incurring any charges to the state, to the Queensland government. She's funding all those arrangements.
How serious?
She got her job. She got it because she works in the entertainment industry. You mentioned those different industries. Is that right?
Yeah, there are a number of people who have come under that category who I've given an exemption to because they have third-party arrangements in place that I'm confident meet all the requirements that we have in place for hotel quarantine.
How serious does it need to get in New South Wales before the border closes again?
Well, it depends where we see these clusters go. So at the moment, they're all being followed up by New South Wales Health, so it will depend whether they start seeing broader spread outside that area.
Dr. Young,